I am curious by nature, and I've spent most of my adult life advocating for people with disabilities and youth in my community. So when I read the job description for Community Innovation Liaison role to reduce the impact of financial strain, I applied. I am always eager to learn, and I wanted to find out more ways to support my community. In my work as an advocate, I saw how financial insecurity is hard enough for people, but then you add things like chronic pain, addiction, mental health, lower or no literacy, lack of social supports, or unhealthy supports, and the hundreds of other little things that can change and fill up the day. For many, it can often seem too overwhelming to move forward. At first, I thought once we had figured out how to reduce the impact of financial strain on the health of one person, we could do the same for everyone else. I quickly realized every patient had different abilities, challenges, and strengths. Every situation was unique. I tried my best to optimistically navigate what seemed at times as an ever-changing system, policies, procedures, and resources. I had to put the pieces of the puzzle together backwards. I started with the person in front of me. Who were they? What are their strengths and challenges? What did they need to access the resources to move forward? Ending with, what do we currently have in our community to improve their health and support their wellness? Our community, like every community, had gaps in services that directly affect financial strain. It was easy to see what we didn't have, but in the process of putting together the asset map with Courtney, the RIF's health promotion facilitator, I learned what we did have. I realized that most of the time we had the puzzle pieces, we just needed to communicate and have some common goals. Learning about how others served our community and identifying ways to partner was essential to reduce the impact of financial strain on people's health. Almost a year after I started, Lacey, the RIF's improvement facilitator and nurse that I worked with closely, told me that she had started to notice something changing in the clinic. Patients they used to see 1 to 2 times a week weren't coming in as often. The only thing that she could identify that was different was the screening tool used at the clinic and the referral to the PCN wellness program. The clinic didn't seem to be the center of their care circle, the community was. As my role in RIFs is coming to an end, I am most thankful for the grace and kindness that was shown to me. For me, the RIFs project created the opportunity and safe space to have a much-needed conversation specifically around financial strain, not only with the people that I serve, but the healthcare providers and the community organizations that I connected with. What we are able to do collectively as a larger group, in my opinion, is the answer to a lot of questions.